I would like to recount a story of a patient whom I came across a few years back. A young, educated 27-year-old male was working as a journalist, was bitten by a puppy when he tried to park his scooter in front of his house. The puppy had bitten him deeply, but it ran away and he ignored the bite, thinking that it was just a puppy. Unfortunately, he came to see me a month later, complaining of tingling at the area of the bite. He was diagnosed to have rabies and we lost him within a week's time. In this day and age, when we have excellent vaccines to prevent rabies, India still contributes to over 20,000 people who die every year because of this deadly viral infection. There is still a lot of confusion. Do all animal bites or scratches require the rabies vaccine? I get called every day when a patient, while he's playing with his puppy or with his cat, gets scratched or bitten. Do you need to give the rabies vaccine? The premise is that you get rabies from an animal bite or a scratch from a rabid animal. So if you have reason to suspect that the animal which scratches or bites you could have rabies, you need to get vaccinations against rabies. But if you're playing and during the course of playing, when the dog is behaving normally and it tends to scratch accidentally or bite playfully, this does not routinely warrant a vaccine. Irrespective of the vaccination history, if the animal is behaving abnormally, you would require to take the vaccinations. So please go to your doctor as soon as you get bitten and get his advice. There are also questions about how soon you need to vaccinate. The sooner you vaccinate, the better. And please remember that if you're suspecting rabies and the bite has drawn blood, if you see blood in the wound, a rabies vaccine alone is not adequate. You need to take the immunoglobulin or the monoclonal antibody injection at the site of the bite. Along with that, you start the vaccine course and complete it. Currently available vaccines are very, very safe. They are not associated with the complications seen with vaccines which were given 40, 50 years ago. It is given in the deltoid or the upper arm, not around the umbilicus, and even pregnant women can safely take the rabies vaccine. Dog lovers, especially people who care for stray animals, injured dogs or cats or sick animals, are strongly advised to get the pre-exposure rabies vaccine. This is typically taken by veterinary doctors every other year to keep their antibody levels up. A protective antibody titer is 0.5, and if you have any doubts after vaccination, you can check your levels, and if it is above 0.5 micrograms, then you are safe. If you get bitten by a dog after you've had a vaccination earlier, you don't need to go through the full course. 2 booster doses are adequate on day 0 and day 3. Lastly, please remember, if you have pets, typically dogs or cats, ensure that they are vaccinated and periodically their vaccine is repeated to keep their antibody levels up. Vaccines are not 100% protective in animals, so ensure that your dogs or cats stay inside the house and protected. If you're taking them out for a walk, ensure that they are not fighting or playing around with other animals which could be rabid. So please stay safe, stay healthy.